What if one short course of Fisetin could reverse frailty in breast cancer survivors after chemotherapy? New data from the PROFFI and TROFFI trials show exactly that, and P16 may be the biomarker we've been waiting for. We're at the MOASC 2026 annual meeting with Dr. Mina Sedrak, who explains the research. In 3, 2, 1. How central is therapy-induced senescence to accelerated frailty in cancer survivors?
Therapy-induced senescence is an important process in which we think may be driving the accelerated aging phenotype that we see in our patients. We think that a lot of the treatments that we use can induce this change in the body, and that the accumulation of these senescent cells that result from these treatments can lead us to developing multiple age-related conditions like chronic conditions, as well as frailty and cognitive decline. Key age-related phenotypes.
Could P16 serve as a practical biomarker for identifying frailty risk after chemotherapy?
P16 is one of the markers that we use to measure cellular senescence. It's a marker that can be measured at the cellular level, at the tissue level, but we can also measure it in the blood. And when we measure it in the blood, we're measuring it from the white blood cells. So it's a level of expression that's on CD3 T cells or other BBMC white blood cells. What's important to note is that it's not a perfect test in humans, and we have not yet found enough data to support relying on just P16 as a marker of senescence, mainly because we think that what might be happening at the white blood cell might not always reflect what might be happening at the level of the tissue, like in the muscle or in the lungs or in other healthy parts of our bodies. And so I think there's more work that needs to be done before we can reliably rely on a test like P16. I think this area of what do we measure in humans to really understand senescent cell burden or the level of an individual senescent cell accumulation in a person is still an area of work, and something that our lab is really trying to work with other groups on to try to better define.
Why did you select Fisetin for testing in breast cancer survivors?
We chose Fisetin, which is a natural flavonoid, because of its really incredible safety profile, as well as the preclinical data to suggest that it has senolytic properties. So Fisetin is a flavonoid that's found in strawberries, persimmons, apples, lots of the fruits that we eat. And what we found in the lab is that when mice are given a Fisetin-rich diet, we see a reduction in markers of cellular senescence, P16, P21, SASP inflammatory markers. We also see that these cells, not only are there markers of senescent cells, but the mice that take Fisetin as compared to the control mice, they have a reduction in frailty, measures of physical function and grip strength and speed and endurance. So we thought that that might represent a potential opportunity to begin to test our hypothesis that we could reverse or reduce some of the accelerated effects in humans. So it's a safe supplement with no serious adverse events. It's well tolerated, and a lot of our patients are taking supplements. And so we thought, why not take advantage of the fact that there is this data in the preclinical world and begin to test it in our population who we believe have high levels of senescence after chemotherapy and other treatments that we give them, and to test it in a safe way to try to understand how it might be applicable to humans.
What is the primary endpoint in your PROFFI and TROFFI trials?
The primary endpoint of our TROFFI and PROFFI studies is a clinical endpoint. It's this change in the 6-minute walk distance. The 6-minute walk distance is a test that's used by clinicians to measure the physical function of an individual. Basically, we have a person walk for 6 minutes down a long 30-meter hallway, and we assess the distance that they walk in that 6-minute period. What we found is that the 6-minute walk correlates with markers of physiologic reserve, like VO2 max and other markers of aging. And so it's a great test. CMS approves this test for patients who have COPD and cardiovascular disease, for pulmonary and cardiac rehabilitation. It's a test that's used by a lot of people. So we thought, if Fisetin can improve a clinical outcome, then it can improve physical function, then we should expect to see a clinical and substantial improvement in someone's 6-minute walk test. And that's what we worked with the FDA on, to try to find an outcome that could really be practice-changing if successful.
How will targeting cellular senescence change long-term survivorship care in oncology?
We think that by targeting fundamental processes of biological aging, like senescence, we may improve outcomes for our patients, both in terms of the health of our patient, improving their quality of life by improving their physical function, their cognitive function, their psychological well-being. But perhaps there may be a benefit to the cancer efficacy outcomes as well. If senescence is a problem that's associated with the cancer progression, tumor dormancy, quiescence, then perhaps by targeting these pathways, we actually can reduce the risk of cancer recurrence and improve the long-term outcomes from a cancer perspective. So we think that there may be a benefit to not only improving people's quality of life, but also their risk of recurrence after their initial cancer diagnosis. What's important is that as we think about our patients and as we think about caring for them, it's important to know that we need to be thinking about patients beyond just the tumor that they have. We've come really a long way by defining treatments that are specific to the tumor that the patient that we have, the DNA mutations that the patients that we see in the clinic. But it's important to know that there's a whole person in whom that tumor resides, and that the treatments that we give our patients are affecting not just the tumor, but that whole person. And this kind of research is really pushing us on the fringe and pushing the needle and understanding that we can't just focus on trying to precisely figure out what tumor our patients have and how can we kill that tumor. We have to take care of the patient as a whole. What about the biology of that patient, and how can we take that into consideration when we're thinking about improving the lives of the patient before, during, and after their cancer treatment?
If you like this video, you may also like the suggested video, Can a blood test detect breast cancer recurrence years early? In the description, you will find a link to a web post companion for this video on oncologytube.com. Thank you for watching.